All right, I'm going to go ahead and get us started off today. My name is Asia Simpson. I am the Wellness and Health Benefits Consultant for Pomona Unified School District. And this presentation today, if you recall from the flyer, is going to be HMO versus PPO. Today's session will be a recorded session, so if you join late or have to leave early, then this will be available to you to review at a later time. I will also include in today's session, in the recordings and the materials, the presentation that I will be covering today. So if you are logging in or logged in, just note that this is being recorded. So if you don't want your face displayed, please make sure you keep your video off. And if you have questions, I would like to try to save them for the end. But if there's a question for clarification that you need while I'm going through the content, no problem at all with you stopping me and asking me a question. I'm happy to answer any questions. I want to make sure everything is clear. So this particular workshop is going to be done as one of several workshops in preparation for open enrollment that is coming up here soon. The packets for open enrollment with information regarding open enrollment will be going out very, very soon. So if you don't have that, don't worry, it will be coming out soon. What you do have in terms of the workshops is really just related to education around prepping you for open enrollment. So I'm going to go ahead and share my screen so we can get started in all of the discussion of all the information that you came here for. And if I can just get a heads up, if you can just let me know if you can see my screen. I'm going to assume you can see my screen. Hopefully you can. So in today's session, the overview of everything that we're going to cover today is going to be, first of all, we're going to talk about why is understanding the difference between an HMO versus a PPO even important. We'll talk about some of the important terms that it will be good for you to know. It will be very helpful for you with navigating and understanding how to utilize your plan. If you ever have any questions and you're talking to your healthcare provider, some of these terms will be helpful for you. We're going to compare the HMO versus PPO in terms of how they work. We'll do a little recap of the differences because hopefully by that time your mind isn't blown and you're completely confused. But we'll recap the differences just to provide a little bit of clarity. And then I'm going to spend a little bit more time on PPOs because they are a bit more complicated than HMOs, quite frankly. And then we'll talk about what your actual specific HMO and PPO options are at Pomona Unified School District specifically. And we'll talk a little bit about what a pharmacy benefit manager is and answer any questions that you might have in addition to that. So let's go ahead and get started. All right, so HMO versus a PPO. Why is this even important? Why does it even matter? Well, it's actually extremely important because the type of plan, meaning whether or not you have an HMO or a PPO, really does impact the providers that you are even able to see. It impacts how you see them, like whether or not you can see specialists right out the gate, or if you have to get a referral. It impacts what providers you can see. So, that's important, especially for people who have providers in mind that they would like to utilize, going forward. And it also impacts what you pay out of pocket in your premiums, your deductibles, your co-payments, co-insurance, out-of-pocket max. So it affects your pockets as well. So it affects a lot of different things. And so that's why it's so very important to make sure you understand the difference between them, because you need to be able to choose one that fits your needs from a financial standpoint and from a health standpoint. So the difference, okay, well, let's see, what is an HMO? I know you all have probably heard the term HMO, but didn't really know what the heck it stands for. An HMO stands for a health maintenance organization. And, in a nutshell, honestly, a health maintenance organizations, they can be very good plans, but there is a big push with this type of plan to really cut costs. So they limit coverage to care from doctors who work only with them in particular. You'll hear the term, are they contracted with your health plan? Are they contracted with Anthem Blue Cross? That means they are an in-network doctor. And generally, this type of plan won't cover you for any services that you go to an out-of-network provider or facility. So if they're not contracted, then generally you're not going to get coverage with an HMO, except in the case of an absolute emergency. So that's one of the ways that they kind of, cut costs, is making sure that it's only with doctors and facilities they have a contract with. A PPO, on the other hand, provides a lot more flexibility. It's really a preferred provider organizations. So it really is what's your preference. So it's a type of health plan where you pay less, though, if you see providers that are in the plan network, but you don't have to see those doctors that are strictly in the plan network. You can go to doctors, hospitals, providers that are outside of the network without having to have a referral, but it could cost you a bit more money. So, in essence, cost isn't necessarily the primary goal for this type of organization. It's really options. It is a bit more complicated, so some people don't like it, but no one can say that a PPO doesn't allow you options. So here are some other important terms to know as we start to talk about a little bit more about HMO versus PPO. I want to take a moment to stop and make sure you're familiar with a few terms, because you're going to hear me mention them, and some of these terms characterize an HMO versus a PPO. Okay, so it'll be important for you to understand this first. So first things first, a deductible. So what a deductible is it is the amount of money that you must pay out of pocket for a covered medical expense before your insurance company kicks in and starts helping with the cost of the services. Now, the deductible is not really an issue with an HMO. It doesn't, for the plan that you guys have, you don't really have a deductible. However, there is a deductible for PPO. So you're going to want to know that it is the amount of money that you've got to pay first for a covered medical expense before the insurance company is going to kick in and say, okay, we'll pay this amount towards the cost of that service. And we'll take a look at some examples so that you can see kind of what that looks like over the course of a plan year. The copays are something you're probably familiar with. You probably have heard about it. Anytime you go to the doctor's office, to go see your doctor or specialist. Copayments are set fees for specific identified services, such as doctor's visits or lab work or prescription orders. You're probably most familiar with that one before any of the other ones. The coinsurance is a cost shown as a percentage ratio, which basically indicates each party's responsibility or the amount of their responsibility towards the cost of a given service. So for example, if you ever hear someone say, oh, it's an 80-20 plan, and you're like, okay, what the heck does that mean? Well, basically what it means is that if you have a service that's say $100 or $1,000, let's use that bigger number. If you have a service that's $1,000 and you have a coinsurance of 80-20, that means the insurance carrier is going to pay 80% of that 1,000 and you pay the other 20%. Okay, so that's kind of how that works. Now, we're not even going to add in the whole deductible piece of it because I don't want to complicate your understanding of a coinsurance just yet. But that's essentially what it means. And then the out-of-pocket maximum, that's really the maximum amount of money that you as the insured person will pay out of your own pocket throughout the course of a year for care towards any of your medical expenses. And this really refers to in-network. It refers to in-network for both an HMO, and it also refers to in-network for PPO. So that's the one thing where they are similar when we're talking about these different terms, is that out-of-pocket maximum is the maximum amount of your own money that you will have to pay for your medical care during the year. And there is a maximum amount. We'll look at those here in a little bit. So I do want to say too, another important term that I want to make sure that you're very clear on is the difference between what is out of pocket and what is out of paycheck. Those are a big deal, and they cause such a big confusion for a lot of people. And some people make their decisions on their health plan based off of the wrong things sometimes, or I shouldn't say wrong things, but based off of a misunderstanding about these two terms. When we're talking about a out of pocket, your out of pocket is really the amount of money that you're going to be paying throughout the year towards the cost of medical expenses. That would be things like whenever you go into the doctor's office and you've got to pay on the spot for co-pays, whenever you have to pay for deductibles, whenever you got to pay co-insurance, whenever you've got to pay prescriptions. These are things that you're paying throughout the year as you make appointments and incur situations where you have to go to see the doctor or get provided health care. How that differs from out of paycheck is the premium amount that is taken out of your paycheck each pay period simply so that you can have that insurance plan that you've chosen. Okay, so whether you use your plan or not, you have to have the out of pocket or out of paycheck premium amount deducted on a regular basis for you to maintain that plan. And then what you pay throughout the year is out of pocket for your co-pays, deductibles, co-insurances, and whatnot. Now, I want to make sure, are there any questions before I move on to breaking out the differences between the HMO versus PPO? Is everyone pretty clear so far about the terminology that we've talked about? Okay, so I don't see any questions in the chat box so far. So I'm going to assume there are no questions, and I haven't had anyone take themselves off the chat. So we're going to go ahead and move on. So what are the differences? All right, so I've kind of alluded to some of this, but let's go ahead and dig into the nitty-gritty of it. So I mentioned before a health maintenance organization, that this particular plan type doesn't offer coverage for care outside of its network. So it's only going to provide care if you see a physician or go to a hospital or facility that is in the network. The only time it will provide any services out of the network is in the case of a true emergency. You are in a major accident and the closest hospital is not in network and you do have insurance. You will be provided coverage in that case. But if you just decide that you want to just go to another hospital because you don't like it, or another doctor just because you don't like what you have, and they don't happen to not be in network, then they're not going to cover that. The other thing with a HMO, which is a big characterization that I want you guys to understand, is that when you have an HMO, you have to assign or get designated a primary care doctor. They're basically like the gatekeeper. They're the gatekeeper in the sense that if you need to see a specialist, you can't see that specialist until your primary care physician provides a referral. They are the ones who are going to control the traffic in terms of who you get to see in terms of specialty providers. And the benefit to the plan on that is that it lowers costs. And the benefit to you is that typically an HMO does have lower premiums that come out of your paycheck. So it's less out of paycheck. And a lot of times, some of the out-of-pocket medical services can be a little bit cheaper. Not all the time, but they can be. So how that compares to a PPO? Well, I mentioned to you before, preferred provider organization really is based off of a lot of preference, where you want to go. You are not restricted. You do not need to have a primary care physician assigned to you before you see a specialist. You can go see a specialist as you see fit, so long as they're accepting new patients. So that's the other thing. You want to make sure that even if you're going to try out a new primary care physician, that they are in fact accepting new patients, because that could be a roadblock for you. And so you can see whoever you want in or out of network. Now, what I will say is that with this, and I'm going back to what I mentioned before, is that if you see a primary care doctor or any kind of doctor and you have a PPO, if you see one that is not contracted with your health plan, then you could find yourself with an out-of-pocket expense for certain services. Some services, it may not make a difference, but others you may end up with a bill. And so that's what a lot of people are sometimes unprepared for, is, receiving a bill thinking that, oh, well, everything is covered. It could be the case if you were in network, but when you go out of network, all bets are off. And in fact, it also does impact your out-of-pocket max. The sky can be the limit if you go and see a provider outside of the network and they charge more than what a contracted provider would charge. There's nothing to prevent them from charging you that. So that's kind of, utilize that out-of-network option at your own risk. And there are some cases where you really just think that the doctor that is not in the network is a better doctor. In some cases they are, but just keep that in mind. So you pay for being able to have that flexibility. And so typically a PPO does have a higher premium. So that's where you see that higher amount being deducted out of your 10thly paycheck, out of your paycheck every month. That's where you'll see that hit. And so because of that, you don't have to really worry about in or out of network, but you pay for that. So just an important thing to remember about that. All right. So let's take a little quick recap one more time, because I know I went over a lot of information, but let's just simplify it. PPOs don't require you to have a primary care physician designated before you start using the plan. HMOs, you must designate your primary care physician, okay? It's the first thing that your HMO is going to make you do. When you want to go ahead and when you feel like you need to see a specialist for whatever reason, maybe you have foot issues, maybe you broke your foot or anything like that, you actually, if you have an HMO, need to wait until you get a referral from your primary care physician to see a podiatrist. If you have it at PPO, you don't have to do that. You can look up, if you have a podiatrist in mind that you want to see, if you're regarding your foot, you look them up, check and see if they are accepting new patients, and you can go in and see them without having to wait for a referral. So there's that out-of-network coverage, but just keep in mind there may be an additional cost. If you have a HMO, you do not get any out-of-network coverage unless it's in the case of emergency. And because of the restrictions with an HMO, you usually have a lower premium, lower or no deductible. In the case of PUSD employees, there is no deductible with an HMO. And you typically see co-payments. You really won't see a lot of co-insurance, not very often. Really where you'll see co-insurance, which if you go back to what I mentioned a few slides back, that 80-20 split, you'll normally see that with a PPO. You won't see it with an HMO so much. And then you'll also see deductibles. So deductibles are, those work hand in hand with the co-insurance. And I'm actually going to give you an example, a plan year example here in a little bit so you can see what I mean by that. But those are the primary differences between the PPO versus the HMO plans. So let's talk a little bit. I mentioned that I was going to explain a little more in detail how a PPO works throughout the course of a plan year, because it is a bit more complicated than an HMO. An HMO is if you're in network, you're good. If you're out of network, you're not covered. That's pretty much the extent of it. And once you hit a certain amount based off of your plan that you've paid out of pocket, then you don't pay anything else after that. PPO is a little bit different. So let's use this example. Let's just say Sally Sue. Sally Sue is you. Let's just say you have this sample plan where your plan's deductible is $1,500, which if you were on just a little bit ago when we looked at the terminology, the deductible is the amount that you must pay as a plan member before the insurance carrier will kick in and pay their portion, okay? The co-insurance is the portion that you pay and the portion that the insurance carrier will pay. In this example that we're looking at here, your deductible is $1,500 and your co-insurance is 20%. And then in this case, your out-of-pocket limit is $5,000. The plan year in this example begins January 1 and ends December 31st. It's just simpler to explain it with January through December But just keep in mind, as a PUSD employee, your plan year begins in October. But for the purposes of explanation, we'll go with January 1 to December 31st. So January is the beginning of the coverage period. December is the end of it. Let's just say you go to the doctor. We're right at the beginning of the plan year. Right now, you haven't spent really anything. You haven't reached your deductible. So essentially, the plan doesn't really pay very much of the cost towards your expenses, other than, having a set, cost for your copay. That's what you would pay, and the plan's not going to pay anything outside of that. They're not going to pay anything. You're going to pay the copays. So in this case, this particular plan, which thank goodness you guys don't have this plan, the office visits are $125. So you go into the office, Sally Sue, and you go see your doctor, and they're like, $125, please. And you're like, man, the plan's not paying anything. So you pay your $125. Well, let's just say that you have an unfortunate year and you have had a lot of expenses, and you finally reach your deductible of $1,500. So just so you know, this almost kind of works like a bucket that you're filling up when it comes to out-of-pocket maxes and deductibles. You've been paying co-pays, you've been paying all of that, and it's been adding up. And unfortunately, you've had so much where you've paid $1,500 worth. Okay, well, if you've paid $1,500 worth, then you've hit your plan deductible. So what that means is, ding, ding, ding. Now the insurance carrier is going to kick in and pay their co-insurance when you have a service that requires a co-insurance. The way that you know a service has a co-insurance is, it's always good to refer to like your plan comparison documents or your summary plan documents. And they'll tell you whether or not, a certain service has a co-insurance. And this particular example, it says an office visit. Let's just say it's an inpatient care type of situation where the co-insurance for you is 20%. Normally, what would happen is, if you hadn't paid your deductible, then you just pay the whole thing. Well, in this case, since we're midway through the year and you've had a lot of doctor's visits, you've already paid your co-insurance. So in this case, you won't have to pay the full $75, because all you have to pay now is your co-insurance of 20%. And sorry about that, previous. And the insurance plan will pay the other 80%. So if we're using small dollars, if $75 is the cost of this service and you pay 20%, then your portion is $15 and your insurance plan is $60 in this case. Okay. So just recap, whenever you have a service under a PPO that requires a co-insurance, the deductible has to be met first. Once that deductible is met, you're only paying 20% of whatever those services are that require a co-insurance for the rest of the year. Okay. Well, let's just say that this is still not a great year health-wise, and you keep having to go to the doctor, and somehow, some way, you end up hitting your out-of-pocket limit of $5,000. Let's just hope none of you have to experience anything like this. But for the sake of this example, let's just say you hit that $5,000 out-of-pocket limit, and you have to go back to the doctor, unfortunately. And let's just say this visit costs $200. Well, in this case, because you have hit your out-of-pocket limit, you're not paying anything if you are in network. The plan's paying the full $200, and you can just sit easy, just utilizing your plan and not having to pay anything more for the remainder part of the year. Now, once December 31st hits, that your out-of-pocket limit and your amount, your obligation to pay $0, that actually resets once January 1st hits again. And this whole process starts again. Okay, so the coverage period begins with your deductible all over again. It has to be paid before any co-insurance will kick in. So there may be co-payments and office visits and specialist visits and all of that you have to pay. But then once you hit that deductible, then your co-insurance is covered for whatever your co-insurance of your plan is. I will have to take a look at the PUSD plan. I believe the PUS plan is a 90-10, but in this example, it's an 80-20. For those of you who are just joining, an 80-20 split, when you hear that 80-20, that refers to 80% the insurance plan pays, 20% you're responsible for. And that dynamic only kicks in once you've paid your deductible. That dynamic is only applicable to services that have a coinsurance. And this is typically seen with PPOs. You don't typically see that very often with an HMO. Okay, so just for clarification. And then if you have to go to the doctor a lot and you end up hitting your out-of-pocket max, once you hit that out-of-pocket max, the plan pays 100% of the remaining medical expenses going forward for the rest of that year, so long as it's in network, until you hit December 31st. Okay? So I hope that I have made something that is pretty complicated a little bit more clear for you. Okay? So I don't know how daring anybody feels right about now. I want to see if anyone is daring enough to answer a few questions. Can anyone tell me, you can put it in the chat box, or you can take yourself off of mute. Can anyone tell me if they remember what the difference between an HMO versus a PPO is? Anybody? Try your luck.
Okay, so an HMO, should I say, am I talking?
Yes.
Okay.
Yeah.
Okay, so the difference between HMO and a PPO is the HMO is you have to pick a network as soon as you sign up. In the PPO, you can go see whoever you want at any time.
Yes, you have to pick a provider before you go see your doctor with an HMO, and with a PPO, you can go see whoever you want. Very good. Thank you for being so brave. All right. All right. Can I get one more brave soul who can tell me what the difference between out of pocket and out of paycheck are, based off of what we talked about? What's the difference between out of pocket and out of paycheck? Come on, I know there's one brave soul out there. Okay, no brave souls. Okay, that's okay, no problem. Out of pocket, if you guys will recall, are those expenses that you are paying all throughout the year as you make appointments to see a provider. So that would be your copay that you pay when you go see your doctor's appointment with your primary care, or your doctor's appointment with a specialist, or lab works that you might have, or if you have a PPO, your deductible, all of those things. Yes, thank you very much, Christiana. You put it in the chat box. So the out of paycheck is what your premiums are that are deducted from your paycheck, simply so you can have the plan that you've chosen. Okay, so you'll essentially, in the worst case scenario, you'll be paying both. You're always going to be paying out of paycheck, because that stipulates what plan you have. Now, how often you have to go to the doctor, that's going to determine how much of your out of pocket is, because it's going to determine how often you go to the doctor, or you get pharmacy, you have to go get, scripts filled, or if you have to go to the doctors. So that's how those two are determined. Okay, so enough of the knowledge check. Let's go ahead and take a look at what your current options are with Pomona Unified School District. So currently, what your current options are is you have 5 HMO options and 1 PPO option. Actually, is that right? 1, 2, 3, 4, 5. Yes, 5 right now. So that is, you have 2 Kaiser Permanente plans. For those of you who don't know, I know sometimes it seems a little bit like Kaiser is its own world. That is an HMO plan, just so you know. Both of them are HMO plans. One is a $10 copay plan, and one is a $20 copay plan. What that simply means is the cost to go see your doctors, your office visits, are going to be $10 with one plan, $20 with the other. If you have the $20 copay plan, inevitably that particular plan is going to have a lower out of paycheck premium than the $10 copay plan. Everything with Kaiser stays within network. All of your work, lab work, who you see is you're navigating and routed through the Kaiser network. Anthem Blue Cross is a little bit different. You would see your traditional doctors at different doctors' offices, different practices, so long as they're contracted in the network. You have currently three HMO options right now, which is the Anthem Blue Cross traditional full network. That means you have a big network of doctors, providers, facilities you can go to. Then you have two more narrow networks that are probably going to be definitely going to be cheaper in terms of premium, and that's going to be the Anthem Blue Cross Premier Select and then the Anthem Blue Cross Classic Select. Now, how these two differ, I'm actually going to show you a slide on the next page of how these HMOs stack up against each other for Anthem. But essentially, the Premier Select and Classic Select, the plan design is set up the same as the full network, but the difference is your network of providers, facilities, hospitals that you have to choose from is a more narrow network. Okay, so that's how it differs from the Anthem Blue Cross HMO traditional. Now, you do have a PPO, which we've been talking about the differences between those, and that's the Anthem Blue Cross PPO. Now, each year during open enrollment, there's always the potential for new plan offerings to be made available. So if there are going to be any other offerings outside of what we're talking about today, you will see that in your open enrollment packet just to provide you with an update on everything. So I just say that to say that this is what they have been thus far. And if there are any new offerings, you may see that in your open enrollment packet. If not, you'll see the same old that you've always seen. So how do the question I always get is, how do I know the difference between these Anthem plans, the traditional Classic Select and Premier Select? Well, how they vary in terms of their overall design, the design is the same, okay? But where they vary it's in terms of the actual costs and limits. So the out-of-pocket limit for the traditional, which the traditional, reminding you, is the full network. It has the larger network of doctors. It has an out-of-pocket limit of $2,000 for single and $4,000 for family. What that basically means is that maximum amount of money you will pay throughout the course of the year for medical expenses that are in network is going to be $2,000 for single, $4,000 for family. Once you hit that amount, you're not paying anything out of pocket. Okay. It's kind of hard to do that though when you have an HMO and you're in network and you're single, unless you have extensive medical issues. Most people don't hit those maximums, okay? Because out-of-network services are generally not covered. The copays for this one, for office visit and urgent care is $20. Specialty visit is $40. And physical therapy and occupational therapy is $20. Now, the Classic Select, like I said, is the design of the plan is the same, but the limits are a little different. They do have the same out-of-pocket limit, but they do have a smaller network of doctors, and the copays and the urgent care for specialty also is the same, but the occupational therapy and physical therapy costs, the copay is $40. And that's where the difference is between this Classic Select and the traditional Select. But the Premier Select is a little bit different. The out-of-pocket limit is lower. It's $1,500 for single and $3,000 for family. And the copays, they're $20, just like the Classic and the traditional for urgent and office visit. However, the specialty visit copays are also $20, which is a bit less than what you would see with the Classic Select and traditional. And the physical therapy and outpatient or occupational therapy is $20. So there are subtle differences. And I will tell you that when you get ready to look at your rate sheets, what you'll see is that this middle plan is going to likely be the cheapest plan amongst the options that we've talked about here today. Okay. So this one is that's the Classic Select. And you can kind of determine which one may cost more or less. It's really based off of the network of doctors that you have to choose from, as well as how much you're going to be paying out of pocket throughout the year for copays and out-of-pocket limits. Minnie, you had a question?
Yeah, really quick on the physical therapy and the copays. Is that regardless of whether you have met your out-of-pocket limit of the 2000?
Nope. If you once you hit the limit of 2,000, your out of pocket limit for all, they have to be all qualifying expenses, then you won't be paying those copays.
Oh, okay. So it's still, so the co-pays is $20 before you hit
Yes,
okay.
correct, correct, correct. Like I said, but it's harder than what a lot of people realize to hit those limits because there's so much that is covered with an HMO. And they do that purposely. They make you stay in network so that you don't incur any charges that will, really cause you to hit those limits. Now, of course, I don't want to, overgeneralize. There are people who have, lots of care that they need and have to see the doctor all the time. So, that may not apply to you. And there are some services that some people may need where their plan doesn't cover 100%. So they may find themselves, paying for expenses that does push them towards that limit. So I don't want to minimize that for people who do hit that limit. All right, any other questions on the differences between the Anthem HMOs? I did not do one for Kaiser because Kaiser doesn't have these types of nuances. The only difference that Kaiser has with the two plans is that one has the copay of $10 and the other has the copay of $20. There's no other differences between those two. So it didn't really make sense to do a comparison on those. All right, so which is the best plan for you? So I get this question all the time, and there's not really a black and white answer to this. And for someone to give you advice about which plan you should go into, I would take it with a grain of salt. I wouldn't say that advice and suggestions that people give are bad and that you shouldn't, consider them at all. But you should consider that you don't know each and every single person who provides you with recommendations, their financial situation, nor do you know the complete detail of their health circumstances. And that's important because they may vary from yours. You may find yourself having to make decisions regarding the plan choices based off of health circumstances or financial circumstances, or finding something that meets your needs in between. The other thing is that when you have children that are under your plan, that's the other thing that needs to be considered. Choosing a plan simply because it has the lowest premium can sometimes end up costing you more money throughout the year. Consider this. If you choose a plan that has the lowest premium, chances are that's going to mean that your copays and out-of-pocket maximum limits are going to be higher. So that's the cost you pay for having a cheaper plan. You pay, more out of pocket, on your out of pocket limits and your copays. And that is fine if you don't typically have doctor's visits or you don't have particularly, difficult health issues. The unfortunate part is with health is that you never really know what's going to befall you when it comes from a health standpoint. So you could find yourself in a situation where you pick a health plan that's the cheapest just because it's what you've already always picked, and then get really sick and then end up having to pay quite a bit, when you go in to see the doctor or for any inpatient services, or you have to go to the emergency room. Those are things that you always need to take into consideration. So I would say, if you are really struggling between which plan to choose, that you really should sit down with someone. I'm someone that you could sit down with. I'm typically available around the open enrollment timeframe where people can reach out to me if you need some help with trying to figure out which option is better for you. Now, I won't be able to tell you, well, you should choose X plan or you should choose Y plan, but I will be able to give you some insightful feedback to help you with making a decision that fits your needs the best. And I will say this too, what fit your needs one year may be different than what your needs are for the next year. So you always want to think about, all of those things when you're making decisions. And if there are other people involved, you also have to take that into consideration. Okay. Were there any questions about which plan is best for you before I move into the last piece of what I'm going to cover? No other questions? Okay. All right. So pharmacy benefit managers. Show of hands of who knows what a pharmacy benefit manager is. Anybody have an idea? I feel like most people don't really know what a pharmacy benefit manager is. So the pharmacy benefit manager is someone who you really won't ever, they're kind of like behind the scenes. They basically regulate, they manage the interactions between the insurance carrier, the people who make the drugs, and the actual pharmacy locations. They coordinate all of this so that you can get the drugs that you need at a lower cost, and they are also serving the needs of the drug maker as well as the pharmacies. So there's a bit of juggling that's done here, and that's kind of how you end up with the pharmacy plans that you have that have your generic cost for generic drugs, cost for brand drugs, and some of the steps that you may have had to go through in order to be able to utilize certain drugs. They call that step therapy. Sometimes step therapy requires, hey, you've got to use this drug and it not work before you can move on to another drug. So that's kind of, the pharmacy manager is the middleman who manages all of these different elements. Okay. And I'll answer your question in just a second, Christiana. The out-of-pocket max for the PPO plan is $1,000 for single, and it's $3,000 for family. Okay. And just so you guys know, all of these out-of-pocket maximums, all of the amounts for all the plans, when you get your open enrollment packets, there is a side-by-side that is created so that you can kind of see how all of those maximums and copays and all of that line up against each other. So in terms of the pharmacy benefit, so SISC is Self-Insured Schools of California is who manages all of your health plan needs. They're kind of like the manager of Kaiser Permanente and Anthem Blue Cross. They kind of manage all of that, and they manage the pharmacy benefits. And so the pharmacy benefit managers that regulate your Anthem Blue Cross plans and Kaiser Kaiser does its own thing. So there's not a different pharmacy benefit manager. Anthem Blue Cross has Navitus, and they manage all of the Anthem plans, whether we're talking HMOs or PPOs. So they are the ones who manage, again, I mentioned before, what's going to be the cost for generic versus what's going to be the cost for brand versus do you have to have step therapy. They are the ones who make those which drugs are on formulary and covered. That type of thing is what the pharmacy benefit managers are going to be, tasked with making sure is in place for the different health plans. So for the Anthem plans, it's Navitus, and Kaiser does its own pharmacy benefit managing. So helpful contacts for you. So this, again, just so you know, if you jumped in a little bit later, these slides are going to be made available to you as well as this recording, so you will be able to reference back to this, as well as all of this reference information is also going to be in your open enrollment packets that are going to be sent out by your district benefits office. And if I'm not mistaken, that information should be going out to you this week. So what's on here? Helpful contacts. You always want to feel comfortable with reaching out to your district benefits office regarding anything regarding your benefits. Anthem Blue Cross and Kaiser Permanente have both the telephone number and the link here. We've got Ash Chiropractic for Kaiser. Ash does the chiropractic, I believe, for Anthem Blue Cross as well. But basically, they are a separate company who manages the chiropractic care. Generally, you don't have any interaction with them unless you have extensive chiropractic services that you need that are beyond the ones that are covered in your plan. And then I mentioned Navitus is the pharmacy benefit manager. And so we have both the telephone number and the link. Most people don't really have anything to do with a pharmacy benefit manager unless they're trying to find out if a drug is on formulary or not. And then a lot of times they may reach out to Navitus on that. And that concludes the content of today's session. And I hope you were able to learn something today. Since we're concluding and closing out the content that I'm covering, I want to find out from anybody if you have any additional questions that you might have, and feel free to drop it in the chat box if you don't want to ask it out loud. But if you have a question, you can also take yourself off of mute. I'm happy to answer your question.
Yes, I have a question. I have a
Sure.
question.
Sure.
Um,